passerei la parola, mi scuso di nuovo con la Valentina, passerei la parola al professor Ronald Gordon.
Let's see if we can get this back. Buongiorno. I want to thank Mr. Bonanno for inviting me to this very important conference. I'd like to try to get this back. No, we've got to go back. There we go. Since the last speaker was trying to present my talk, I was asked to present the concept of the trigger dose. In the U.S., we refer to this as a threshold effect. It's an old concept that we no longer adhere to there because we believe that all exposures are important and all exposures cause disease. We're good. It's on. All of the fibers go to all of the airways, and you can see here are documentations of the earliest findings of asbestos in certain organs. However, clearly the lymph nodes are not generally affected. However, they are the transits for fibers to other organs in the body. The liver and kidneys, although they found fibers in, they no longer followed these organs of whether there was any tumor production or any disease associated with it, to my knowledge. Clearly, the most important areas with regard to asbestos is the development of fibrosis, or in the presence of asbestos, asbestosis. Later, I will show you some pictures of what this looks like, the production of lung tumors, and we always use those as a separate category as opposed to mesotheliomas, which are different than lung tumors, and the GI tract tumors. That's all of the elemental. I will talk about that again later. And then female sexual organs, which I published on earlier as contaminants of talc in most instances. The types of fibers that we consistently look at are the serpentine or the chrysotile type. Those are the most prevalent fibers. The amphibols then are listed down here. Chrysotolite, amosite, anthophyllite, and tremolite, actinolite. The tremolite, actinolite are generally contaminants of chrysotile. Tremolite and anthophyllite are also contaminants of talc. Here's some electron microscopic images of, this is chrysotile, and these are the amphibols. You can see that these are more wavy as compared to the amphibols, which are very straight. The amphibols stay in the lung or in the tissues a lot longer. If we use a comparison of the fiber numbers, if we look 20 years ago or longer, we would see them in the millions. In today, when we look in the tissues, we see them in the thousands. Well, the question is where did they go? This, if we refer to them in the same patients, that is, of course, Where did they go? They got moved out of the lung very slowly. In the case of the amphibols, in the serpentines, we'll talk about that. They get broken down and they get transported into the lymph nodes and out to the pleura. Now, the important issues are the toxicity of the fibers. You've got this is the order of toxicity in the lungs or in the tissues. You've got crucidolite is the most toxic, amosite, anthophyllite, tremolite, actinolite, and then chrysotile. So you can see that it reverses from the way I had them before. However, we will talk about the fact that if you look at them by light microscopy, you can actually see the fibers. This is in lung tissue. These are the asbestos bodies that are produced. And usually, this is a very high exposure that was taken a long time, that was taken probably in the early 80s of a patient who was exposed to crucidolite. The formation of bodies usually indicates that these fibers have been in the body for some period of time. And it's usually a marker, therefore, of how much is in there. However, the one thing you've got to be careful of is that the chrysotile fibers do not form bodies very well in most individuals or most people. So you don't see asbestos bodies, and therefore, when these fibers get broken down, they disappear and they're gone. You don't see them in the organs that you're looking for. Therefore, it's like a hit-and-run accident with a car. The bodies are formed best on long amphibols and less so in short amphibols. Now, the mechanisms of deposition, to a large degree, you breathe them in or you drink it. It can be in the water system. The water systems can be contaminated and frequently are contaminated. So if you breathe it in, it comes through the oral cavity or the nasal cavity. Then you've got the upper airways, lower airways. The fibers actually can spear into the cells, or they can they can be taken up by the macrophages. And then they're moved. They're moved to the lymph nodes. They're moved to the pleura. And that's where they cause the mesotheliomas. You can swallow drinking water. And then the other way is that the breathed fibers that are picked up by the macrophages get into the airways, and they're brought up with the dust. And then during the night, you swallow those fibers, and they're now in your GI tract or your elemental tract. And then there's another type of mesothelioma in the abdomen called peritoneal mesothelioma, all right? And those usually are from fibers that move through the GI tract into the tissue. The other components which we did studies on is the sexual intercourse. Workers come home. They don't necessarily shower. They've been working all day. It comes from their clothes. They have sex with their wives, and it gets into their vaginal canals and into the uterus and up in the fallopian tube and to the ovaries. The same thing with the contaminated talc that was used on condoms, and women that do a lot of talc applications over the years. That's also been contaminated. We're doing a lot of studies with contaminated talc right now. So it can come from all of these things. Now, the mechanisms of cancer or carcinogenesis are a form of oxidant injury, whereas these fibers cause direct injury by the surface characteristics of the fibers. The other way is when the fibers enter the cell, it goes through the nucleus, and it actually changes the DNA directly. The combination of the two is what gives you cancer. Now, that's where it comes to the issue of the, quote, trigger dose or threshold dose. You don't need millions of fibers, but statistically, the more fibers, the better chance you're going to get cancer. However, even with a smaller amount of fibers, over a longer period of time, will give you the same result. All right, we can skip this one. Now, this is probably the most important slide that I'm going to present today with regard to this particular topic, and that is if you have the best chance of getting cancer or fibrosis is a high dose with long exposure time. Now, that's people who work 20, 30 years at a job and they're continuously exposed. Then they stop working. A lot of these people started to get sick at the end of their careers because it takes some years before you see it, 8 to 10 before you'll ever see any disease. And then later on, the tumors start to develop and the fibrosis starts to develop. Usually the fibrosis comes first. The heavier the exposure, the fibrosis will develop first, and then possibly the tumor. Many people die of fibrosis or asbestosis before they even develop tumors. The next is high dose and short exposure. We've seen in the United States people that have worked with this material for 1 week, and never worked with it again. And 20, 30 years down the line, they've developed mesothelioma or lung tumors. So clearly, there isn't a significant dose requirement to develop these tumors and these diseases. The lower dose, you want to have a long exposure, and lower dose and short exposure is the least likely to give you anything unless it tends to be crucidolite or amosite or anthophyllite, the amphibole type asbestos fibers. And here's a listing in the sequence of the fiber in the dose leading to tumors. However, if you add time into the element, chrysotile then becomes a significant component over time, 30, 40 years. We're now seeing more mesotheliomas in people who are exposed to chrysotile than we are seeing people who are exposed to low levels of amphiboles, low levels of amosite, low levels of crucidolite. Now the size of the fibers. We have the Suzuki concept, where they're short fibers. One important thing to remember is that you don't necessarily breathe in these short fibers. That's a critical issue, all right? Especially if it's chrysotile, because that's what Dr. Suzuki was looking at, was the shorter fibers found in the mesotheliomas directly, all right? Those fibers come primarily from the lung, that are longer fibers that are broken down and moved to the pleura, rather than those that are breathed as short fibers. Of course, there are also amphiboles of long and short. I mean, we do see long fibers as well in the pleura. It depends on the amount of the exposure, but in general, when we do, I'll talk to you later about fiber burden analyses. When we do fiber burden analyses, we don't generally do it in tumors per se, because they don't, you don't see many fibers actually in the tumor itself. And now in the United States, fiber counts are significantly less, and the backgrounds are, if we look at patients who have absolutely never been exposed to asbestos, those levels have come way down. And the issue, however, is the latency. That means the time that people have stopped using the material and have done nothing, maybe retired, and then all of a sudden, 5, 10 years after that, they start developing mesotheliomas, lung tumors, a variety of other diseases. And the reason why things have gone down in the United States is because it's no longer used anymore, and it's been abated. It's been removed, especially, I mean, there was all the schools, from a federal standpoint, required them to remove it. These are just some of the control levels that we've had based on this date. The newer levels are showing, and these are background controls, and they're even significantly lower than this. Of what we're finding, what you should be looking at is the mean over here, and you can see that that's very low. Now it's even lower, it's close to 0 now. However, that's only a recent group that we have. We use lymph nodes as a guide because, especially with chrysotile disappears from the lung within 10, 20 years after its exposure or after it's stopped. It's gone, but we still get the diseases from it. And here are some of the controls in the lymph nodes that we look at simultaneously to see if we can identify chrysotile. If we can't identify chrysotile, we can frequently find tremolite, which usually is the low-level contaminant of the chrysotile itself. I have 2 slides here which show 100 cases of mesothelioma. What I wanted to point out about these slides is it's so variable, and there aren't that many necessarily fibers found at the point at which we look as compared to what they had 20 or 30 years ago. Now, these are an aggregate of cases that are over a lot of years, which indicate that there's a lot of mixed fibers. Carpenters, construction workers get mixed fiber exposures, and it's hard to sort them out. Then you have the mechanics, the brake workers. Those generally get the least amount of exposures with chrysotile, and it tends to be a smaller chrysotile. But when I say smaller, remember we're talking about fibers that are greater than 5 microns in length, because I don't look at anything less than that. Dr. Suzuki in the mesotheliomas was looking at all the fibers, including the ones that were less than 1 micron in length. But the reason that I use that 5 micron measurement is because when I look at my background controls, the background controls are never more than 1 micron in length in those patients that have never gotten the disease. All right. However, the ones that we find, if we find it greater than 5 microns, we know that they are occupationally exposed in one way or another. There's just a little bit more. It's the other 50, I believe, of the cases. And you can see it's very mixed. And in some instances, we don't find any chrysotile in the chrysotile-exposed lungs, but we can find it sometimes in the lymph nodes, which is, again, on this side. Now, clearly, as we compare then and now, it's typical that before the workers were unprotected, there's no environmental precautions, the environmental air filled with fibers, etc. Down the line now, all of these things have been taken into account, and we don't see it in the background. However, the most important take-home for today with regard to this talk is that the fiber types that you're exposed to are critical. And the bottom line is that it's all the fiber types of all the exposures, unless those exposures occurred less than 8 to 10 years ago. So it's very important to understand that there is really no real threshold effect that we're seeing as of today in the United States anyway. Thank you.
Grazie professor Gordon per questa vera e propria Lectio Magistralis, e grazie davvero, visto che insomma i suoi studi, le sue indagini, le sue ricerche sono fondamentali per tantissime inchieste, numerose inchieste che sono anche in corso.
Volevo ringraziare di cuore il professor Gordon per essere presente oggi qui con noi. E lo ringrazio di cuore. Io ho avuto la fortuna di visitare l'intero piano dove lui lavora, di ospedale, ha un'organizzazione perfetta e riesce a fare dei lavori veramente incredibili, e magari ne vedremo degli altri però nella seconda parte del convegno del pomeriggio.